Do you feel a destiny with COVID as well?
Having all that preparation really gets you ready for something like COVID.
Could we be entering an endemic period? It's been 3 years and we are still plagued by the COVID pandemic. But the vaccine has given us more control than ever before. The pandemic has taught us that distribution and development of vaccines is more vital than ever before. That is the mission of the International Vaccine Institute, which is headquartered in Korea. Our Globalist today is its Director General, a third-generation Korean American, Dr. Jerome Kim. Welcome, Dr. Jerome Kim, to the show.
Thank you very much. It's a pleasure to be back here, and Happy New Year.
Happy New Year to you, too. Let's get right into it. Okay, you were in Korea throughout the pandemic. You've obviously been vaccinated.
Right.
Fully.
Over
What was the
again.
last vaccine you got?
Most recently, because I'm going to be traveling in the next few weeks, I received the Moderna vaccine. Now, the Moderna vaccine, the new one, that has two
strains.
Yes.
And did you get COVID?
No, not yet.
Oh,
Knock on
really?
wood.
So all these vaccines have vaccines plus
Plus masks and distancing
masks,
and
caution,
hygiene.
So in a way, you can't tell people it's okay to please get vaccinated, number
Yes.
one. But even if you catch COVID, don't panic.
Yes, and the message around vaccination and diagnosis the messages are still very important.
In terms of vaccines and the COVID-19, and I think a lot of people remember seeing that first live TV pictures of the first vaccine shots going into the arms of, I think they were medical professionals in the US. And I remember thinking, we're saved. I'm not going to die. What went through your mind?
I was thinking, not the beginning of the end, but maybe the end of the beginning. Because we had gotten through the pandemic, with whatever means we could, mask, distancing. Countries like Korea did it with tracking and tracing and isolation and treatment. Other countries had a much different approach, and we saw huge differences in rates of death. But then we had a solution, and this was the end of a process. So I was thinking, the end of the beginning of the pandemic.
Something that you were very excited to see end.
Maybe mistakenly, that the solution would be much more widely adopted much more quickly and would be distributed equitably or more equitably. We had been warning about it and we'd been talking about it, and that was a bit of a disappointment during the stretch from the beginning of 2021 through 2022. That in the end, there's still, in low-income countries, 75% of the people have not received a single dose of vaccine.
You're right in saying that when that happened, was that in 2021 with the first
the beginning
vaccines
of
were started?
2021, end of 2021.
Did you think at the time, we're sitting now in 2023, 2 years later, and we are still in this stage that you were just talking about where some of the low-income countries have not been able to vaccinate their people?
The biggest shame is, we have a vaccine, actually a bunch of vaccines in our hands, and we had evidence that they were safe and efficacious. But we were unable to put together a comprehensive solution that took a vaccine that works and got it into the arms of the people who needed them. And in the end, our old professors of vaccinology always told us that it isn't a vaccine, it's vaccination that saves lives. And so when you look at the failures, it isn't that we don't have enough vaccine. Even at the end of 2021, countries were asking, can you use this vaccine? Otherwise, we'll have to destroy it. Low-income countries were asking that. So it isn't the vaccine, it's vaccination. And sometimes we miss that point because that same need for vaccination exists today. We haven't solved that problem. And, as we think about the great gaps that there are in our response to the pandemic, vaccination is going to be one of them. And it will require a lot of work, but it will have enormous benefits, not only for vaccines, but for the other aspects of healthcare, because healthcare is central to our work against pandemics, but also to health.
Overall health. I mean, in my field, in the field of PR communications, you talk about the pluses and minuses. What do I get for what I give? And vaccines, it's not clear cut about what I get for the pain, the uncomfortableness, and maybe, the time spent, which I don't think I need. So that communication might not have been as clear as we would like.
We have a lot of sayings, a stitch in time saves nine, an ounce of prevention is a pound of cure. But the ironic thing about a vaccine is if you take it and you don't get influenza, do you realize it, that it's benefited you?
Probably not.
No.
Well, you don't thank the vaccine for not for being healthy.
Right. And so that's the problem. We're actually victims of our own success in the vaccine field, because if our vaccines work, if they're safe and efficacious, if they keep children from dying of measles, if they keep children from dying of infections of the brain, meningitis, then we don't see them. In the past, in the United States or in Korea, we had these epidemics of measles that would kill tens of thousands of children. We don't see it anymore. And most parents have never seen a case of measles. I mean, although in my mother's generation, they saw a lot of cases of measles, and I had chickenpox, and we all had these childhood diseases that we don't see anymore. Pediatricians don't see them anymore because vaccines work.
But then why are people not getting vaccinated? We're going round and round again, but why is that trust not there?
Trust and acceptance of vaccines has been a remarkable thing. I mean, we had this global consensus that vaccination was good. For every dollar you invest in a vaccine, you get back $44 to $50 in savings in healthcare costs. So these things are kind of invisible. Countries see it. And in general, low and middle income countries are big proponents of vaccination and support these vaccination programs. But around COVID vaccines, which had to be given to everybody, we had a special set of issues. A tremendous amount of vaccine resistance being spread by actually a relatively small group of people in high-income countries, primarily in the United States, but elsewhere as well. And for 2 years, these messages were bombarding people who lived in low and middle-income countries. So as the vaccines became available, all these questions that people had were asked again. And in China, the mistrust of vaccines led to a really unfortunate reversal of what we would want to see. At the start of their big wave, 50% of the people over 60 had not been vaccinated. And we knew what was going to happen because we'd seen it over and over again.
Since you brought up China, how serious is the Chinese issue now for us living in the COVID world?
And I have to say that this is my best guess because we really don't have data. It's very serious. And why? Because when you think about the population of China, right? If you're thinking about 1.4 billion people, And you estimate that maybe 50 to 60 million are over the age of 65. And if you estimate that half of them haven't been vaccinated, you have a population maybe, the size of a good-sized country, completely naive to COVID. And, we think, Omicron is not a bad germ to get. It's actually worse than the flu if you're not vaccinated and if you're over 60. In Korea, in the beginning part of the first Omicron wave, there was data from the Ministry of Health that suggested that in the unvaccinated population over the age of 65, the mortality rate was 5%. That's significant. And if you think about the Chinese population, now take the Korean population and increase it to 1.4 billion and assume that a good number of the elderly weren't vaccinated, then you're looking at a significant number of deaths, theoretically. But we don't have data. We don't see data coming out of China, unfortunately.
And the Chinese have opened their doors and they're traveling around the world.
Yes.
And people are traveling to China. So does that mean that until it's over in China, it's really never not over?
So China is a problem primarily for China right now, because we've seen pictures. We don't have official data, but we've seen pictures of hospitals and intensive care units being full, of lines outside of mortuaries and crematoriums, and the fact that lots of interviews from people standing in those lines that I've been waiting here for a day in order to get a place to bury my father who died of COVID. But of course, none of it's being reported. So we really don't know the true extent of what's going on. Countries have offered to help, and I don't think the Chinese government has accepted any of those offers, but new mutants are being generated. And when we think about people with conditions that decrease their body's ability to respond to infection, for instance, a person with untreated HIV infection, the virus actually has a special ground to mutate. Because the body doesn't get rid of the infection as well as it would if you were young and healthy, the immune system tries to fight against it, and the virus begins to adapt in the body of the individual. So that sometimes you can be infected for extended periods of time, and that's when these...
So the body sort of incubates a virus and allows it to maybe grow into something else.
Right, and it's in these individuals that these new viruses presumably are arising. And where are they? There are a lot of people with untreated infections around the world. So to say it's just China's problem, I think, is understating it. China is a big problem right now, and I hope that the government is able to work to provide care to all the people who are infected, who need care. Because we know, there are lots of people in hospitals.
Yeah, and especially, as you say, if they have not been vaccinated, it's a different matter.
Right.
It's hard to foresee anything, but in the next couple of years, if nothing that you talked about in terms of the seriousness of what it could happen in terms of spreading and getting more serious, could we be entering an endemic period?
The way these infections usually evolve over time, we will enter an endemic period. And I think we're still trying to understand what that will look like and what the implications will be for healthcare systems around the world. And increasingly, people are thinking that there may be vaccines that we can develop. We don't have a perfect idea what they are yet, that are much more broadly protective, that will not only protect us against XBB 1.5, which is the latest craze in the United States, but against future coronaviruses, and maybe even against things like MERS and SARS at the same time. So that's the kind of...
The super shot, sort of.
Yeah, kind of a super shot, but also one that lasts longer than 3 months or 6 months. And it looks like, at least in animal studies, that there are some vaccines that are looking very promising. Actually, some of them have just started. And within this year, there will be additional vaccines entering clinical trials, and a lot of the urgency is gone. But having a better vaccine would be an important step forward.
Yeah. Something to look forward to.
Mm-hmm. 1 month in a hospital in Texas, and then they said, we're doing research on HIV vaccines, and we need to send someone from the Air Force there. We think you would be a good candidate, so why don't you go to work with Bob Redfield at Walter Reed Arm Institute of Research. So Bob Redfield is the former head of CDC. We have a lot of strong support from the Korean government, the Indian, Swedish, and Finnish governments, and then the Gates Foundation. And that really, opened my eyes about the possibilities in vaccines and what they can do and what the limitations of our current model for vaccines.
IVI posted 2015, so it's now 8 years. We're getting into 8 years. But you are a medical doctor and you are a colonel in the United States Army Medical Corps.
Was a colonel.
Was. Retired.
Retired, yes.
But what led you to vaccines?
And to the Army, of all places. But in the United States, medical school is very expensive. And the U.S. military offers special scholarships to people who've gotten into medical school. And it was my way of going to Yale, to medical school.
The funding your medical education.
Yes, and actually, though, it was the Air Force that had done that. And in the end, you have to pay the military back by serving an equivalent number of years. And at that point, the Air Force was working with the Army on an HIV vaccine. And they said, we'd like to send you there because you've done research on HIV and we thought it would be a good idea. And it was a very unique opportunity because the Army is the lead agency for infectious disease vaccine research in the military. And people don't know it, but the Army has developed a significant number of vaccines, maybe up to 8 different vaccines that we use today were developed by the U.S. Army. And so this is a legacy. And I was very lucky to be able to end up in this group with some really remarkable people and to move HIV vaccines forward. And of course, HIV, we call it a neglected disease in a sense because it's not a disease that a big company will get involved in vaccine research for. And in fact, there's only one big company left working on it,
Really?
Janssen. It's a difficult virus to develop vaccines against, very different from COVID in a way.
But that led you, the HIV led you to COVID. I heard Dr. Fauci, Anthony Fauci, saying on some interview in the United States that all his training, all his life, his passion has sort of led him here. And he sort of felt like it was his destiny to be there when COVID struck. Do you feel a destiny with COVID as well?
No, I don't think so. And in a sense, maybe Dr. Fauci was in a different place in his career. Certainly, we all had training in helping to develop vaccines, frustrations in vaccines that didn't work as we'd hoped that they would work. Having all that preparation really gets you ready for something like COVID, but equally something like MERS. Working at IVI has been a real eye-opener for me because I was very focused on HIV. But being at IVI, International Vaccine Institute, and working on vaccines that are not commonly worked on by large vaccine companies like Pfizer and Merck and Sanofi has really been a new experience for me and such an important experience because it really prepared us, in a sense, for some of the things that we thought we were going to see during COVID, if we didn't develop a vaccine, if we didn't distribute the vaccine equitably, if we didn't have diagnostic tests in order to be able to identify people with COVID infection, if we didn't have the ability to manufacture billions of doses of vaccines. Those are problems that we see for most of the vaccines we work on. And COVID, it happens to be the pandemic, the 1 in 100 year pandemic. But many of the other things that IVI does helps us to think about vaccines not only as a simple technological solution, but as something that has to be given to be effective.
As a doctor of Korean descent, third generation Korean American, other people at the United Nations or around the world, which they come to you for advice and all of that, have asked you every once in a while, as a Korean American, how did Korea do it? Why is Korea so effective? And seeing if you had any insights that other people wouldn't have had.
So I think I have an advantage of being both internal and external. And so, for instance, if you think about the pandemic in 2010, the influenza pandemic, and the US informs Korea, you know, that vaccine that you bought from US companies, we can confiscate it because it's our law that the US government can use vaccine in the US for national security purposes. And, you know, you tell one of your friends that, the country, one of your ally countries, they're a little shocked that you could do that. And so that started Korea thinking about, how do we think about vaccine security? We're the number 11 vaccine manufacturer in the world. We are 80% dependent on imports for vaccines. If this happens again, what's going to happen? So the government started this process, which you don't see in many governments, of thinking about how do you plan for vaccine security? Well, so by 2016, they'd invested in a vaccine research center. They'd built these 2 large plants owned by different provinces that can manufacture vaccines. And then at the other end, you know, the Korean government was thinking, well, we need more R&D in vaccines. We need to train people to work in vaccine industry or a biomanufacturing industry. And how do we do that? So now they have these large R&D clusters, and these are funded over multiple years to develop the science and scientists to work in a thriving biotechnology industry. And then, of course, in 2021, the K-vaccine initiative was developed, and that is billions of dollars, trillions of won, to make sure that Korea is the number 5 vaccine manufacturer by 2025. And to watch the evolution of the government programs for a US person is really kind of unusual because the US government tends not to get involved. But if you want to change.
Yeah. And maybe in this area of vaccines is sort of different from the other private sector areas?
Well, maybe not so different from, you know, if you need semiconductors or if you want to build a new battery industry or if you want to take over large screen TVs.
That's the way the Korean government sort of approaches these things, missions, as they would say.
Right.
In a way, the COVID pandemic has allowed the vaccine industry has really to reach the next plateau in terms of all the processes that you've talked about?
Yeah, it's actually been, COVID has been remarkable in a sense because it shows that we have the technical capacity to be able to move a vaccine from, you know, a newly identified germ to a safe and efficacious vaccine. So completion of phase 3 trials, emergency approval within 11 months. We've never done that before. And it allowed us to make a second demonstration, which is we could make 13 billion doses in a year. So it's manufacturing was there. The problem was distribution and then implementation. And if we failed in that, you know, the vaccine doesn't save lives. It's the implementation of vaccination that saves lives. And so in that sense, we failed, unfortunately.
Do you feel that it's your mission to maybe address these failures in the future?
So not only my mission, but the International Vaccine Institute's mission of discovery, development, and delivery really has an emphasis on development and delivery. If we had better equity in the distribution of vaccines, we could have saved 40% more lives around the world. So those 8 million people died because we couldn't assure that vaccines were distributed to the people who needed it the most when they needed it. And, you know, Korea is amazing in its ability to vaccinate, you know, 90 to 95% of the population that needs vaccination. But many countries around the world don't have the health infrastructure necessary to do that. The IVI is working on all these different areas now, not by ourselves, but to try to build a consensus around what we need to do the next time.
Through providing the right information, education.
Right.
I guess that's their number 1 defense.
Yes, well, training. Diagnostics, teaching people
Science.
how to use and develop and manufacture vaccines, and working to try to strengthen vaccination programs.
Well, I hope that is very effective, more effective than it was in the past anyway. I think that is all the time we have this week. Thank you very much for joining us on this week's program. And for me, we have been talking with Dr. Jerome Kim, the Director General of the International Vaccine Institute, about COVID and other viruses that we need to be prepared for in the future. So next week, I will be back with another globalist who's putting Korea on the map. Sun Ji out.